So when patients come in for a cosmetic consult with myself, I usually review all the modalities we offer in the office, starting with the laser to work on the skin surfacing. Then there are fillers. The fillers have really come a long way. And patients who maybe have had a poor experience before, I encourage them to re-engage in options and the non-surgical options with fillers, because I think the trend now is a very natural look with correcting structure instead of just filling lines. So for patients who are thin and have had bumpiness in the past to patients who feel like they just have been underwhelmed by the results, I think it's a good time to just re-engage in different options. What we try to do when patients come in is exceed their expectations. So it can be as minor as just treating them very lightly with an injectable treatment versus doing a whole package with a lot of different filler, because we want patients to feel like they are a candidate and they are pleased and exceed the cost kind of results, downtime expectation. The lasers that we offer here really do amazing things for skin texturing. Then it's a little bit of volume loss. So we like to complement them with filler. And filler is intimidating to women because I think that they see a lot of things out there, or maybe their husband doesn't recommend it because of what they've seen. But I think most women are having some sort of cosmetic treatment done, and they're just getting it done well if they look a little bit younger than their age and if their makeup just sits nicely on their face. So I think it's a neat time to kind of re-engage in it, because it's a lot of structural correction, trying to correct bone loss and instead of just filling lines. And I think there's a nice balance that we're able to offer, since we do offer all the injectables. It's a nice balance where we're able to really fine-tune treatments and tailor them to individual patients, because if you look in magazines, it's overwhelming, all the different options that are available. And I think it's just a matter of figuring out what is best for each individual patient. As well as we like to come up with a year plan. Not everything should be done and can be done in a day for aesthetic outcome as well as costs. So what we try to do is really kind of come up with a nice year plan. We provide patients a calendar mapping out a year and how we can almost reverse aging. And my favorite before and afters to show patients are patients I've been taking care of since 2013 and now, and how you see this reverse aging, but still looking very natural, age appropriate, not looking like they've had a lot done. So it is amazing because there's even non-surgical options for fullness to the face. A lot of different off-label uses for different products that really keep the face looking as natural and photographing well versus just filling lines. Because sometimes when women come in with concerns in the lower face, if you fill the area, you can make women look a little bit more masculine by squaring off their jaw. And I think right now we just have so many good options in our tool belt to really help improve how women photograph, which is more important than filling lines, as well as more natural. And I think that is what encourages patients to know that they are a candidate for non-surgical plastic surgery. And I think once they get in the door, it helps not deter them from seeking out these non-surgical procedures to feel better. As well as I think what does deter is sometimes when women look like they have too much volume in their face. The nice thing here is that I just introduced them to Dr. Lickstein, because occasionally it's more natural just to have a little bit of skin taken surgically, as well as there's a lot of minimally invasive facelifts that Dr. Lickstein performs that can revise something maybe you've already had done, or just lift the face and take a little bit of skin, and it's an interesting thing, but sometimes that is the more natural result than adding volume and continuing to add volume. So I like to, fortunately I help him in surgery as well, so I have, I feel like I can always discuss things with him and talk about plans for patients so that we come up with the most cost efficient way to make you look better in a year, but yet keeping it very natural.